خب بذارین من مهمون امشب و خانم دکتر جما جناتی و ریزی رو معرفی بکنم. ایشون تحصیلات انگلیس دارن و الان دارن متخصص دندان پزشکی هستن و الان دارن توی USC سال آخرشون هستش که میدونیم مثل همه ما که باید دوباره درس رو اینجا بخونیم تا امریکا بهمون لایسنس بده، اون سال آخرشون هستش. ولی رزومش رو براتون میخونم. در ضمن جما جان، جما اسم انگلیسیشونه، ما بهشون میگیم ساناز. سانا جان عروس دکتر ریزی هستن و پارسال با دکتر بیژن ریزی عروسی کردن، عروسی بسیار جالبی و من که دوستشون هستم بهشون افتخار میکنم و همه ما خوشحالیم این که توی ما هستن در امریکا و با این خانواده نازنین ازدواج کردن. خانم دکتر جناتی فعلا الان داریم میگیم تا اینی که تبدیل بشه جناتی ریزی احتمالاً. ایشون ایژوکیشنشون رو گفتم در انگلیس شروع کردن چون اونجا به دنیا آمدن، ولی فعلا دکترا و دنتال سرجریشون رو از می 2022 شروع کردن توی USC و سال آینده تموم میشه و لایسنس پرکتیس دنتال سرجری رو در امریکا هم میگیرن. ایشون توی یونیورسیتی آف سنترال لانکشیر بچلر آف دنتال سرجری گرفتن که سال 2016 تا 2020 بوده. یعنی ایشون لایسنس پرکتیسینگ سرجن و دنتیستری هستن در کشور انگلیس و مسترش رو در فارماسی گرفتن. فکر کنید یه دنتیستی که فارماسی هم بدونه. در یونیورسیتی آف ایست انگلیا تو یونایتد تو یونایتد کینگدم در سپتامبر 2011 تا جون 2016. ایشون هم فارماسیست هستن هم دنتیست هستن و کالجشون رو توی درست اگه اشتباه تلفظ نکنم ویجنسن اند کوین الیزابت کالج انگلیس رفتن. اواردهای متعددی گرفتن. توی سال 2020 رویال کالج آف سرجن سیرونا ریجنال فرست پلیس وینر بودن. در بریتیش اکادمی آف کاسمتیک دنتیستری در سال 2018 و 2019. در سال 2015 توی UEA برونز سکیل اوارد گرفتن. در سال 2011 اینترنشنال مت اوارد گرفتن، سیلور اینترمیدیت اوارد در سال 2010 و برونز سینیور اوارد در 2011 و در دوک آف ادینبرو از دوک آف ادینبرو سیلور اوارد 2010 رو به ایشون دادن و در مایکروسافت و کامپیوتر خیلی ایژوکیتد هستن. همینطور فارماسی دنتیستری و در قبل از اینکه دنتال اسکول برن در فارماسی متعدد انگلیس کار میکردن. در ضمن ایشون اگریکالچرال فارماسیوتیکال ریسرچر هم هستن و یکی از هابیاشون هم بی کیپینگه. اونجوری که من میدونم دختر بسیار خانم با سلیقه هستن و we are very proud to have her as a guest امشب. بفرمایید.
Hi, salam. Thank you so much, Dr. Madani, for your introduction. And برای همتون که امشب اومدین on a Monday evening. But without further ado, I'm going to just share my screen. ببخشید من ایرانیم It's good, understand میکنم و اگه سوالی دارین که از ایرانی translate کنم let me know, but I'm going to be presenting in English and I'll try and translate if you want me to do it in Iranian. I'm just going to share my screen. Can you see my screen?
بله میبینیم و این برنامه اینی که گام اینفکشنش چقدر روی هلت ما مؤثره مدتی بود توی فکر من بود و میخواستم که کسی که کوالیفاید باشه پیدا کنم که راجع به این برنامه صحبت بکنن و خوشبختانه دکتر جناتی ریسرچ هم توی این کار انجام دادن. اگر ما لستمون اینفکشن داشته باشه منتظر بیماری‌های بعدی هم باشیم و یکیش الزایمره که ایشون روش کار کردن و ما بسیار خوشحالیم که و جواب کارشون رو به ما میگن و ما رو روشن میکنن. بفرمایید خانم.
Merci, thank you so much. So at the moment, researchers زیادی هست راجع به مریضای لثه and it can cause مریضی قلبی, cardiovascular, all sorts of systemic diseases. ولی Alzheimer's disease تازه they found this research and it's still هنوز is within research and they found a lot of information. So today we're going to be looking at any potential links that we've found in research between periodontitis. Periodontitis is like مریضی لثه which has progressed into more severe form, which we'll discuss what that means and how that can link onto Alzheimer's disease. But because this is still a new part of research, we're going to be looking at the theories behind چجوری این دوتا با هم associated هستن in the two conditions. So Alzheimer's disease, so Alzheimer's is a chronic neuroinflammatory disease that many of you would know. It leads to the atrophy of the brain tissues and causes cognitive impairments and death. One of the hallmarks of Alzheimer's disease is actually the amyloid plaques and neurofibrillary tangles. And this activate these proteins which get deposited within the brain, activate a huge immune response, and it starts destroying our brain cells where these proteins are deposited. So the main place that Alzheimer's disease actually affects is your hippocampus. And this area of your brain is actually essential and important for the long-term memories, spatial awareness, navigation. So damage within this area and shrinkage within this area causes the memory loss. Again, we are not able to navigate. Alzheimer's disease, actually, 1 per 4 seconds, someone is diagnosed in the world. Currently, more than 55 million people in the whole world have got Alzheimer's, and it's actually approximated that 81 million people will have it by 2014. This just highlights why we need to reduce any risk factors and get to understand this disease even better. Let me change the page, sorry. Okay, so what is periodontitis? Periodontitis is also a chronic inflammatory disease as well, affecting the gums and supporting structures of your teeth. This also includes gingivitis. This is one of the most prevalent chronic conditions in the world. It affects 20 to 50% of the global population. In its most advanced stages, the chronic inflammation causes damage to the bone around the tooth and causes you to lose your teeth. The periodontal inflammation becomes more chronic when our body systems are not able to actually eliminate any of the bacteria or is not actually able to balance out the destruction. It's an inflammatory effect actually in response to bacteria. The American Academy of Periodontology actually estimates that 3 out of 4 Americans are affected by periodontal disease. So therefore, again, it's one of the most prevalent chronic infections that we have got in the world. So let's discuss this a little bit further. So this is a nice diagram, and it gives you a quick summary of what periodontitis is. So initially, you've got a good tooth there. You can see in this image. Let me just get my cursor up. Here you can see my red cursor. This white, this is your tooth, this white object. Around it is your gums, which is in pink on both sides. And then you've got the yellow area, the dotted area, which is your bone. So this is a nice image that just shows what a healthy tooth looks like with very well supporting structures. If you go on to image number 2, you can see that gingivitis actually starts with the accumulation of dental plaque. And this yellow part in this image is showing it. It's quite sticky, it's colorless, and it constantly forms around your teeth. So when you brush your teeth, within minutes of brushing your teeth, you get this buildup of plaque. It starts with being good bacteria. It's nothing to be worried about initially, and then as time goes on, this biofilm actually becomes more harmful. So that's why we say brush your teeth twice a day to remove this plaque buildup, because after a day the environment becomes toxic. So if you don't remove this biofilm, you get this redness of the gum, so inflammation of the gum, and you get bleeding as well. But you can see the bone is still intact and no damage to the bone. But over time, this plaque can, if it's not removed and through regular brushing and flossing, the bacterial plaque multiplies and thrives within the oral environment and becomes more harmful to your gums. It irritates your gums, and it accumulates much more and releases way more toxins, and goes on to periodontitis over some time. So periodontitis actually is the plaque that's deposited in this area, and with future damage, it causes the bone breakdown. As you can see, the yellow area starts breaking down, the gums start detaching from your tooth, so you can see these pockets are forming, and you can see this plaque biofilm is starting to go further down the root, and you get recession. Again, the tooth starts moving. Some patients might report movement of teeth, and again, if you don't get this it fixed at this stage, you're going to go into more advanced stages of periodontitis, and this is basically total loss of your teeth because the damage is so significant, it's not savable. Even a dentist within advanced periodontitis stages is unlikely to be able to save this tooth, and this tooth does need to come out. And that is mainly because of starting from a very simple thing of plaque buildup, which could have been removed by just brushing and flossing appropriately and sufficiently. It goes on to you losing your teeth. So without any intervention, the gingivitis progresses, the bacterial inflammation spreads below the gum line, and forms periodontitis. It's important to note that actually the poor oral hygiene is one of the main risk factors, but other risk factors such as smoking, hormones, diabetes can also contribute. So, one other common type of gingivitis would be pregnant women can complain of bleeding gums. And again, this is because of the hormone changes. And if they ignore that, it can then also progress to periodontitis. So it's initiated by another type of risk factor, but also poor oral hygiene plays a main role in this. So what are the signs and symptoms of periodontitis? So this image actually is a good summary of what periodontitis can look in more severe cases. So you've got the swelling and the puffy gums in these areas. You can see it's quite apparent here. You've got then the patient may complain of like, my gums feel quite tender, or they may even say my teeth hurt. And that's common because a patient can't differentiate between the pain that's coming from the gums and the pain coming from the teeth. So when we have the patient that says they've got tooth pain and we do the relevant diagnostic tests and there's nothing wrong with the teeth, it's most likely going to be the gums. You've got the red, swollen, purplish gums. The gums bleed really easily. The patient might complain that they had an apple and it started bleeding. There's blood on the gum, on the apple, or they brush their teeth and there's blood on their toothbrush, or that when they spit or floss, they get blood. And actually, that's one important thing is that a lot of patients I've spoken to, when they brush their teeth and floss their teeth and they suddenly see blood when they're flossing, they stop flossing. And they say, I've not flossed because when I floss, I start getting blood in my floss and I'm damaging my gums. Actually, when you do see blood on the floss, it's actually identifying to you that that's the area where there's inflammation and there's probably some plaque in that area. So you need to actually be more thorough within those areas. Don't ignore the blood on the floss. Actually, this is identifying to you, clean me more. Within 7 days, that bleeding will stop if you are flossing daily in every area, but significantly in that area. Another differentiating factor of knowing someone has periodontitis, a patient may come in and say that their partner, their spouse, a family member has mentioned to them that they have bad breath. A lot of the time, the patient themselves can't smell the bad breath. Sometimes they may, but it's very apparent and it's profound halitosis. Again, and that's because of periodontitis. They also do sometimes complain of pus between their teeth, or we can see it anyway clinically. Okay, so let's have a look at how periodontitis actually forms. So you've got your tooth tissue there, and we said that it starts with plaque around the teeth at image number 1, just there. The plaque builds up, and actually the plaque isn't too bad initially. It's a symbiotic microbial environment, but it then changes and transitions to a dysbiotic environment, which actually forms the periodontitis. So in a healthy oral cavity, there is a balance. You've got your oral microbials, which are good microorganisms, which protect you, they protect the immune system and the host, and they're all living in a balanced environment. And the oral bacteria is in harmony and actually stabilizes your oral environment. But what happens is that once you go into dysbiosis, it's referring to an imbalance, a disruption in this community, and therefore it starts causing damage. The factors that cause this change from a symbiotic, which we have here, to a dysbiotic microbial environment is initially the poor oral hygiene, but also you have genetic predispositions, you got smoking and stress. Some medications can change you from a symbiotic to dysbiotic. One could be calcium channel blockers. You've got your systemic conditions such as diabetes. Again, your immune response is weakened, therefore you can't fight off smaller infections or smaller bacteria, and therefore it pushes you to an unbalanced dysbiotic microbial environment. The inadequate oral hygiene if you don't clean sufficiently with your floss or your toothbrush, once this biofilm at image number 1 here builds up, it automatically forms this accumulation, maturation of that dental plaque after several days starts favoring an environment which bacteria start thriving and changing the environment of types of bacteria. So the dysbiosis actually, it causes a shift in the composition of this bacteria, and it causes these newer bacteria to form toxins. The immune system actually responds to the dysbiotic bacteria, and in the presence of these and the byproducts that they're forming, and your inflammatory response is significantly activated. But initially, this response to this dysbiotic bacteria that your body has is actually helping repair any damage. So the gums that are inflamed, your immune system is trying to reduce the inflammation, clear the plaque away, clear any damage there. But the dysbiosis bacteria, the inflammatory response they undertake is actually significant, and this inflammatory response becomes chronic, and disproportionate, causing actually that tissue damage to be significant. So actually, when the immune response is activated, instead of it becoming activated and resolving, it doesn't ever resolve, and it's constant breakdown of this bone at image number 3, resorbing the bone because of this. So in summary, so how does the bone actually break down? It's combined with when the immune system is activated and the complement and PRR is activated, the osteoclasts become activated. And once the osteoclasts are activated, it causes the breakdown of the bone. Let me just move on to the next slide there. So let's see what are the similarities between periodontal and Alzheimer's disease, and why do we feel that these pathological features actually link in together? So both these conditions have a microbial component. So as we said, the periodontal disease, the microbial challenge, so it goes from a symbiotic to a dysbiotic environment, and is primarily caused by the presence of the pathogenic bacteria in dental plaque. While in Alzheimer's disease, it's actually been associated with the presence of specific bacteria, which is P. gingivalis. And we'll go into that further in a few moments in the next few slides. But P. gingivalis, which is actually proven to be the bacteria causing Alzheimer's disease, causing the immune inflammatory host response, is actually the exact same bacteria that causes periodontal disease. Both periodontitis and Alzheimer's are characterized by the chronic inflammation. So periodontal disease, as we said, causes the bacteria, the microbial challenge there, causes the activation of a chronic inflammatory disease. Alzheimer's is exactly the same, and causes the damage to the tissue and the brain cells. Whereas periodontitis, the damage is to the teeth and the bones around the teeth. How does the immune system actually link in for both of them? So in periodontitis, the immune response is triggered by the bacteria and the byproducts, which are the toxins, causing the inflammatory response around the teeth. In Alzheimer's, the immune response causes an activation of a cell called microglia, which is an immune cell, which contributes to neuroinflammation and damage of those areas. Because I don't know if you know, but microglia is a tissue in your body, which is an inflammatory cell, which helps actually clear up any debris within your brain, such as A beta deposits or any tangles. Both of these periodontal disease and Alzheimer's are both involved in tissue damage, and the destruction primarily affects the gums in periodontitis, whereas in Alzheimer's, again, we said it's the brain tissue and causing cognitive decline. Both of these conditions also have environmental and genetic factors that are which actually progress or cause these conditions to have shared risk factors. So both of them actually have, as with age, you have increased risk of periodontal disease as well as Alzheimer's. Chronic inflammation causes an increased risk of periodontal disease as well as Alzheimer's. Poor oral hygiene affects both. Lifestyle factors such as smoking also affects both. So there's definitely some link going on. And let's go on to the next slide. We can discuss this a bit further. So there are many theories out there in research at the moment, one being the amyloid and tau protein theory, the next being the bacterial theory. So the amyloid tau protein theory. So the amyloid plaques and tau tangles are not only features observed in the Alzheimer's disease brain, the inflammation is also present. In the inflammatory hypotheses, they say that these proteins present in the brain is actually causing the Alzheimer's disease due to the activation of the immune cells that cause the breakdown of your healthy neural tissue in the brain, causing the pro-inflammatory cytokine release and then tissue damage. Let me just go on to, so you also have the issue with these tau proteins, the amyloid proteins, you have the chronic inflammation within the brain, that oxidative stresses that also cause an increase formation of these proteins as well. The bacterial theory suggests that the specific there are specific bacteria that are shared between them, as we discussed, one being P. gingivalis, and that causes periodontitis as well as Alzheimer's. So the bacteria and the inflammation cascade, they both can travel. The bacterial theory states that the bacteria that's present in periodontitis can actually travel through the bloodstream into the brain, and the lab studies have proven that this is probably a close link to it. So what bacteria are we talking about? So one of the most putative bacteria found in the oral cavity in periodontal disease is actually P. gingivalis. P. gingivalis is one of the strongest bacteria that's associated with periodontitis. It produces toxins that damage the gums and cause inflammation and cause an inflammatory response. And the studies have shown that that's also the same bacteria that causes the progression development of Alzheimer's disease. F nucleatum is also associated with periodontal disease. And again, once they did lab testing and bacterial testing those around the teeth that had periodontitis, they saw that this bacteria is present. But the studies also showed that actually F nucleatum is also, and it plays an important role in systemic health issues and systemic inflammation. And they saw that this bacteria is also present in brain samples of Alzheimer's patients. So when they looked at a study where Alzheimer's patients had died, when they looked at their brains and took samples, this bacteria was present, F nucleatum. And then we've got Treponema denticola, again, another strong link with periodontal patients. Patients with periodontitis had this bacteria present. And it also was played a role in Alzheimer's disease, and it provoked an immune response and was detected in the brains of patients with Alzheimer's. And last but not least, A. actinomycomitans. This bacteria actually is present in the most aggressive forms of periodontitis. And within studies, they found that this bacteria also was present in the brains of patients with Alzheimer's. This just shows that, so how does this bacteria in periodontal patients actually affect the patient? So how does it actually travel to the brain and cause Alzheimer's? Or is there a link? Is there an exact link there? So let's have a look at how gingivitis actually does cause initiation and progression of disease linked to periodontitis. So as we said, P. gingivalis is a bacteria associated with periodontal disease and oral infections. It produces enzymes called gingipains, and the gingipains are toxic enzymes produced by the P. gingivalis. They actually change the host protein and contribute to the pathogenicity of the bacteria. Once the P. gingivalis is then able to pass the blood-brain barrier and penetrate it. So from the gums, it goes into the blood supply in that area around the gums and travels straight into the blood-brain barrier. Once in the brain, it activates the microglial cells. So it releases gingipains, which then in effect causes an activation of microglial cells. The microglial cells, as we said, are immune cells in the brain that are responsible for the immune defense and the maintenance of the brain homeostasis. And the presence of the gingipains, as well as the activation of microglia, leads to the transformation from a resting state within the brain to an activated and unstable inflammatory state. This causes chronic neuroinflammation within the brain, and it causes the amyloid beta plaques are not able to be cleared no longer, and it causes damage to the brain cells itself. When they looked at the brain cells of 53 deceased people who had Alzheimer's, who had been diagnosed with Alzheimer's, they found that there's such a significantly high level of gingipain enzyme in all of them. And the gingipain actually enzyme tends to rise over time with patients that had more, which were in later stages of actual dementia. So this is a diagram which can, again, it's similar to the step down diagram which we looked at, but it's more graphic, so you can get a better understanding. So you can see here that this image in number 1 is showing a tooth with periodontal disease, and it's got the plaque and it's got the pocketing, which the bacteria are actually sitting in, and it will be P. gingivalis. Okay, so the P. gingivalis is outer membrane vesicles as well as other toxins it forms, translocate from that plaque biofilm through the blood supply and microcirculation, and it enters the brain. And it can enter the brain either through the microcirculation or through the intestine blood supply, is found in research. So normally the blood-brain barrier, we always assume that is extremely strong and doesn't let anything be transferred into the brain. However, because of the inflammatory toxins that the P. gingivalis actually forms, it causes that the blood-brain barrier to become leaky, and causes that the P. gingivalis and the outer membrane vesicles, as well as gingipain enzymes, to directly break through the barrier of the and enter the brain. And the permeability of the blood-brain barrier is actually increased because of this bacteria and its toxins. So you can see in this image number 2, the presence of gingiva pains and the other toxins causes the amyloid beta plaques formation to occur within the brain. What gingiva pains also does, it causes the APOE fragmentation enzyme to actually be inhibited, and that is no longer able to break down the amyloid beta plaque formation. Gingiva pains also activate the microglial activation, which we just discussed, which then in effect causes tau fragmentation and tangles. So these are all the proteins that start clogging up the different areas of the brain, and we're unable to actually clear them, and then therefore causes damage and activation of a microglial, which damages your own brain cells in effect. And you are no longer able to, at this point, do synapses within the brain are affected, the neurons start dying, and then atrophy of the brain, which we said at the hippocampus. So F-nucleatum. So the potential link between F-nucleatum Alzheimer's is still an emerging area of research. But the exact mechanism in which this bacteria is able to be involved in the transition from periodontitis to Alzheimer's is still being investigated. But our current understanding of this bacteria is that it's associated with chronic inflammation, which is periodontal disease. It's affecting your gums and your jawbone if you've left it untreated, causing the loss of your teeth. And it invades your oral tissues, causing that chronic inflammation, which then later travels through the bloodstream again, just like P. gingivalis, and enters the brain through the permeability of the blood supply. Once it's in the bloodstream, the bacteria is able to, as we said, trigger a systemic immune response. So whereas P. gingivalis enter the brain and then causes the cascade of events of producing different proteins, causing an inhibition of certain enzymes and activation of destructive enzymes, what F-nucleatum does, it causes a full-blown systemic immune response. So this bacteria has been shown to not only affect periodontitis, but also cause many other systemic diseases and affect many other organ systems. But the mechanism of how it undertakes any of this is not fully proven. What we have seen is that in the latest research actually done by Tufts University was that they infected 2 groups of mice. They put F-nucleatum they injected into half the mice, and the other half they didn't inject any F-nucleatum. And what happened is over some time, they saw that the F-nucleatum mice that had that injected, they took brain samples and it was present in their brain. So it is able to cross the blood-brain barrier and enter the brain of these mice. And it also caused an activation of microglial cells, which when they took the samples from these infected mice, they had an increased inflammatory response, an intense number of microglial cells activated within their brains. They also undertook testing on these mice. So the mice that had been infected with F-nucleatum had reduced memory loss, increased memory loss, but reduced memory, and were unable to think cohesively like the other mice. So their signaling pathways had been affected. This was a warning sign to researchers because that showed that the F-nucleatum bacteria is able to travel through the body system of these mice and enter the brain. So this does in effect show that by just having periodontitis, being infected by this bacteria, it doesn't take too much for it to actually travel through the blood system to get to the brain and trigger a whole cascade of events. So we discussed how these bacteria can cause periodontitis and then move on to causing Alzheimer's. But let's not forget that the other systemic inflammation disease can occur. So once they did testing, the elevated levels of inflammatory markers found when patients with periodontitis had an elevated levels of inflammatory markers within the brains of Alzheimer's patients. They also increased the patient's risk of diabetes with just having periodontitis. There was increased risk of infected endocarditis and other heart diseases. The bacteria from periodontitis is also a risk of being, once aspirated, cause increased risk of pneumonia. They also saw in studies that men with gum disease were 49% more likely to develop kidney cancer, 54% of patients with periodontitis were likely to develop pancreatic cancers, and 30% of periodontitis patients, when they researched them, were more likely to develop blood cancers. So this just shows you it's not just Alzheimer's we're worried about. Periodontitis is just a small, minuscule disease at the forefront, but it causes a huge cascade of events within the whole body. So just a quick summary of what studies have found. So we did epidemiological studies, which showed that the exposure to chronic periodontal disease actually increased your risk of having Alzheimer's disease fourfold. When they did imaging studies on via PET scans, they saw that the patients with periodontitis disease had actually visual evidence within PET scans of Alzheimer's disease or risk of having Alzheimer's disease because they saw these amyloid plaques present. Animal studies, as we said, when they did mice testing and they took samples from the brains of these mice, as well as having a look at the cognitive impairment of these mice, they saw that it did affect them that were injected with the bacteria from periodontitis. Human studies, again, once they looked at patients with that died from Alzheimer's disease, when they did sampling of their brains, they saw that there was a significant number of periodontal bacteria present within the brain, as well as the toxins and inflammatory markers. So this does show a link between the two diseases. So future research, there still needs to be a significant amount of research. It's still very new. We've just been able to see similarities and links, but we've not been able to identify an exact formation from one to the other. We still need to do more longitudinal studies because right now we're just picking out all the different research and doing all the different lab tests, but we need to really watch the exposure of these patients over long periods of time that have periodontal disease and see whether at what stage is it going to cause Alzheimer's, after how long is it going to cause Alzheimer's. So there is so much research that needs to still be done, and we're just at the very tip of it at the moment. So how can we utilize all this information that we've just presented and we've just found to actually help us right now to help mitigate the systemic inflammatory burden and potentially impact the progression? We want to inhibit and stop the progression of Alzheimer's disease. So there needs to be public initiatives that promote the oral hygiene practices. Make people aware that the periodontal disease, the gum disease, gum bleeding is not normal, and you need to get that treated. You may just think it's bleeding gums, but we don't know what's exactly happening in this huge body system. It's just one little sign that you see your floss has blood on it. It's a sign that there is so much more happening within your brain, within your kidneys, within your heart. So we need to make sure something as simple as good oral hygiene has to be maintained. Visit your dentist regularly. Go as regularly as possible. Make sure that you visit your dental hygienist, and it's essential for your not just your oral health, but your whole systemic health. So what are the current guidelines for periodontitis? At the moment, as a dentist, our current guidelines is reducing the overall plaque burden. So we know it all starts with the plaque that causes the triggering of events. So brushing your teeth, using floss to reduce the risk of gingivitis. Some guidelines say using a soft brush. The English guidelines say using a medium brush. It doesn't matter, as long as you're really removing that plaque around the teeth and preventing it from causing the cascade of inflammation. What can we as dentists do? We will measure look at if your gums are bleeding. We will, at every appointment, your checkups to the dentist, we check your gum health. We check your bone to see if there's any pocketing. We check if any of your teeth are moving, because these are all important points we look at to diagnose you with periodontitis or not. And it's really important for you to be involved as a patient, because you need to know how you're going to help treat this. And As a hygienist, as a dentist, we may give you a clean once every 6 months, once every 3 months, once a year. But that's not going to change much unless you change your actual oral health habits and you start brushing, because once a year cleaning is not sufficient. We will also look at if you have any fillings or anything that causing the plaque to be more retentive. So if you sometimes go to a dentist and you get a filling put on, and when you floss, you can see it's catching, those fillings actually have more likely to cause more plaque buildup. So these fillings may need replacing. And there's so much a dentist can do, and that just highlights how important it is to visit your dentist regularly to ensure we maintain your oral health. Again, some more evidence of what is done for even adults between the age of 12 to 17. We're going to be discussing different types of, from as young as age 12, we start discussing how you're going to be cleaning in between your teeth, what type of interdental brushes you're going to be using, stop smoking. If you've got diabetes, we want to see you way more regularly than any other patient because you're actually more likely to have periodontitis occurring. So what is good oral hygiene advice? So in summary, we have got, you need to brush 2 times a day, minimum. Any more than that is up to you. Is the evidence doesn't show that there's any more significant improvements, but twice a day is your minimum, and it has to be for 2 minutes. And the reason why we say 2 minutes is because 2 minutes is how long we have worked out it being for you to actually effectively brush every single one of your teeth. So some patients say, oh, I can do it super fast. I can do it in 30 seconds. No, because in 30 seconds, you're not able to get to all the crevices of your teeth sufficiently. Flossing every day, using interdental brushes, using a mouthwash as antimicrobial. Stop smoking, because what smoking does, it makes your mouth very dry and causes this shift from symbiotic to a dysbiotic bacterial biofilm environment. So, and that's an exact link that has been found in this. Don't drink so much alcohol because it's full of sugars, because sugars actually cause the harvest and it causes the proliferation of these bacteria, again, shifting from a symbiotic to a dysbiotic environment. Visit your dentist. Dry mouth is important. If you have a dry mouth and increasing with age, you have polypharmacy, and increasing age, you have a decrease of saliva flow. And we tend to ignore that we've got a dry mouth, but having a dry mouth is extremely dangerous in actually maintaining good oral health, and you're actually more likely to get periodontitis and gum disease. So if you have got a dry mouth, we as a dentist will be providing you with something called saliva substitute, so it can stimulate your saliva flow. We will be advising to take regular sips of water, put an ice cube in your mouth, anything like that, because you don't want to have a dry mouth, because it can damage and cause other sorts of diseases. Visit your dentist at least once a year, but depending on what we feel, if we feel that you're at high risk, we may want to see you a lot more quicker and schedule your hygienist appointments. I know most of you all know it. You're all very aware of how to brush your teeth. But what's very important is you need to make sure you angle your toothbrush at 45 degrees angle here. So because the bacteria actually build around the gum and around the teeth, and we need to get that removed in that crevice. So get your toothbrush, angle it at 45 degrees and really remove that plaque. Don't press too hard because you'll start causing damage to your gums, but do ensure that you angle your toothbrush. And that's something that a lot of people don't do. Using a soft bristle is up to you, or if you want to use a medium bristle, and that means how thick or how hard this toothbrush is. Don't use a hard toothbrush, just a soft or a medium bristle is enough. And just tip it and brush all 3 surfaces of your teeth. So a lot of patients ask me, should I use a manual brush? Should I use an electric brush? What's the difference? As long as you brush your teeth, I don't mind. If you want to use a manual or electric, some people are strongly against electric, and that's fine. Use a manual, I don't mind. But research does say that electric brushing is it has been found to be beneficial and reduce plaque more than a manual brush. So within 1 to 3 months, once they monitored patients that were using electric brush, within 1 to 3 months, they saw that there was actually 11% reduction in plaque. But after 3 months, they saw 21% reduction in plaque in these patients that use electric brushing. For gingivitis, they saw that patients that were using electric brush had within the first 1 to 3 months, they had 6% reduction in actually being diagnosed with gingivitis. And then after 3 months, 11% reduction when using electric brush. I know these numbers don't sound so significant, but in the grand scheme of things, it's quite significant. It just shows that electric brushing is more effective. Again, if you don't like it, don't use it. If it's going to stop you from brushing your teeth, then yes, just do your manual brush. It doesn't matter. There's so much different research done around which toothbrush is better, which one you should use. But the conclusion is the powered toothbrushes reduce plaque more than the manual brushes, because the movements they do are much more direct and much more stimulated than what you can achieve with just manual brushing. There's 2 types of main electric brushing. You've got your Oral-B, and Oral-B toothbrush in this image, if you can see my cursor, it rotates around, and that kind of disturbs the biofilm and removes the plaque. Whereas the Philips, which we call the ultrasonic, it vibrates. So personal preference, most of the research has been done on Oral-B brushes, which rotates, and they say that's effective, but it doesn't make a difference. Just either one, just pick one, and 2 times a day. Flossing, again, there's many types of different flossing. There's so much research out there. Get your floss and clean, push it up towards the top of your gum, take it out, push it up towards the top of your gum on both sides of the teeth. If you don't like flossing, use a flosser. So that's much easier. It's got the plastic handle. If you don't like using that, the water flosser. So all these different bits of equipment have been made for you to make it easier for you to floss. It's very important. It's essential for oral health. Water floss is actually a new thing. The research says that it's not as effective as being manually flossing and using internet brushes. You should add it to your add it as another tool to cleaning your teeth. So it has to be done alongside flossing. But if you don't find flossing easy for you and you don't enjoy it, and it's not something you're actually able to cope with, use a water flosser. Interdental brushing. So I think there's a bit of information confusion for patients, which I see personally, between should we floss or should we interdental brush? They're 2 very different things. In this image, in the first image, you can see this is dental floss. If you see my cursor, it's moving. That is what floss is. It goes down, it doesn't touch both teeth, it touches one tooth each time, and it just kind of removes the food interdentally where the teeth actually contact. The interdental brush is like a bottle brush. It cleans and removes any debris between the 2 teeth, which is next to the gum, where we've got it circled on the cursor. And on this other image, you can see the toothpick. Do not use them. They cause more damage than any good at all. So when you're choosing an interdental brush, you need to make sure you choose a size that's not too small, not too big. And actually your dentist can help you, or the hygienist can help you find out which size you need to use. But you need to floss and interdental brush. It's not one or the other, it's actually both. If you don't want to floss, you can do your water pick, but you need to interdental brush. So what when you visit your dentist or hygienist, what actually happens during the appointment? So there's a number of things. We do scaling and debridement. So we remove any of the plaque, buildup, calculus around your tissue, the gums, and the teeth at the top surface of your teeth, just above your gum. But if you have got periodontitis and you have those pocketings, we do go under the gum and we clean out under the gum to allow for the gums to reattach onto the tooth, because the deattachment of these gums is what is going to cause the pocketing and for the bacteria to harvest in these pockets. We also polish and smoothen all the tooth area as well as the root area if you've got the pockets, because any roughness on your teeth, anything that feels sharp to your tongue or to even us feeling it or to the floss, is going to cause a black plaque buildup in those areas. And we also will be treating your teeth with fluoride. With patients that have more advanced periodontitis, we will also do gum surgery. And gum surgery, what we do, we either remove the gum in the pocketing areas to actually close off the gap so that the bacteria can't sit in those pockets, or we may actually do gum surgery to build up gum and put bone there to actually eliminate the pocketing again and make it easier for you to clean. We may even think to put dental implants in those areas, because if you have any missing teeth, it's actually more difficult to clean all the surface of your teeth. So putting dental implants in those gaps can actually allow you to have more food clearance in those areas and easier to clean, and a more stable tooth structure. So finally as well, so what medications are available? You have mouthwashes. One of the main ones that we have is chlorhexidine mouthwash. It's a prescription only mouthwash, which the dentist can give you. It's a fantastic antimicrobial mouthwash. Is one of the main ones that's proven to be amazing against periodontitis. But this mouthwash will eliminate bacteria, but shouldn't be used more than 7 days because it can cause staining of your teeth. Again, if your dentist believes and sees that there is evidence of periodontitis, they may prescribe you this mouthwash, and it's very important to use it as they describe it to you. They may give you oral antibiotics. Again, oral antibiotics have not been proven to be effective, but in some immunocompromised patients, they do tend to use them as well. Or they may put like more local compounds into the pocketing areas, which are small amounts of antibiotic sheets that are put into pockets to reduce the buildup of bacteria as well. So all in all, how are you going to reduce all the systemic inflammation? I know we discussed by visiting a hygienist reduces your oral inflammation and dentist, but you can also to reduce directly any source of inflammation by exercising, reducing calorie intake, any chronic infections that you visit your doctor, stop smoking, and also take omega-3 fatty acids, antioxidants in your diet are all very important points. So in summary, periodontitis and Alzheimer's disease actually share the common pathological features, and they both have the feature of chronic inflammation and a huge, massive dysregulation of your immune system. There are many theories, such as the Bacterial Theory, the Amyloid Theory, which includes the Tau protein theory, that actually proves to us there is some sort of link between these two. They both have systemic inflammation or systemic connections and many shared risk factors. So there we can see there's a potential link between the two conditions, but we haven't found an exact proven link as such yet. I hope you enjoyed that. I know it's a lot of information, but if you have any questions, I'm happy to take them.
مرسی خانم، خیلی ممنون. You went from A to Z, very complete presentation. Excellent presentation. You know, at the end, again, obesity, diabetes, exercise, food, omega-3, and on. Basically, a lifestyle, a good lifestyle, and then dental care. I'm going to order my water paint. That's the only one I don't have.
Well, you've got your electro brush, that's great.
Right. Excellent. I really enjoyed it.